Oh, the chat's blank. Wait, why is the chat not here? Hello, good morning. I don't know, good evening. Hindi pala morning. Good evening. Teka, bakit wala yung chat dito? Oh, okay, I see why. There we go. There's the chat. Oh no, the chat's gone again. Hello. Good. Hello, good evening. There we go. There's the chat. Hello, hello. Hello, Pokari. Hello, Archetype Henpai no. Hello, Skynerd. Hello, Ventix. Hello. Hello. Yeah, sorry for the delay. I had to do something. That's why I was a little late. Yeah, so, actually this stream, this medical education stream is, I'll make this it's more informal. Okay. Wait. Because actually this is not about, tawag dito? This is not about diseases, actually. It's not about surgery diseases. It's more about the system. Or more like the hierarchy. Ortho resident, yeah, oh my god, we have an ortho resident here. Hello. I hope you're having fun playing with bones or something, I don't know. Playing with them bones. Okay, hold on, let me just I'm going to have to make my keyboard wireless right now because I am going to use a tablet. Wait. Alright. And my keyboard is not working. I unplugged my keyboard, now it's not working. What's wrong with you? Okay, wait. I need to reconnect this. Oh. Okay lang yan, Dokre. At least malapit na ang Halloween, bruh. Yeah, my keyboard is not working properly. What the hell? Are you serious? I can't type. Wait. There we go. Ayaw talaga gumana. Oh, there we go. Now it's working properly. Okay. I am on wireless keyboard mode. Because I'm gonna put my tablet... Wait. Kasi yung tablet ko. Because I'm gonna end up... I might draw and everything, you know. I have no slides for this because this one doesn't really need slides. It's gonna be more like me telling you guys a story. Or making cuento. Or, you know. How is it? Let's see. You know, the hierarchy. What is the hierarchy in the medical field? Ay, teka. Wrong gloves. Wait, where's my other one? You know how in you know how in like corporate business office whatever there is a hierarchy, right? Like you're an employee and then you have like you have someone on top of you. You have a supervisor and then you have someone higher. I've never had a office job, so I don't. What is the? Let's see. Let's look at what is like the hierarchy in a in an office job. Let's see, office hierarchy. Because I don't know. You should have a white for this. Yeah, I will. Don't worry. I'm just I will open up like MS Paint in a bit. Organization hierarchy. Here we go. Can use an image here. Hold on, wait. There we go. This is a good example, like a really. Wait, let me open up a window here. Hold on. Okay, here we go. Where's yung window ko? Where'd my window go? Oh, okay. This window's in the way. I'm gonna... wait, you know what? let's go to... Wait, instead of here... Teka ha. Oh, what the heck? Hold on. Bakit nasa tabi pa ako dito? Okay. This one. Ito. There we go. Okay, here we go. Alright! Where's my, music? Yan lang, ha? There we go. Okay. Good evening, Doc. Taking the PLB this week. Oh, so we got some examiners. We got some people taking the physician licensure exam soon. Nice. Okay. So I just went on Google and then looked for organizational hierarchy. So basically, I guess this is it. In general, so you got like the staff, and then you have like a little head up here, and then you got the most, I think, the manager, whatever. I don't know how it is in other offices, to be honest, because I've never worked in an office job. But you get the gist. If you guys have worked, if other people who are like not in the medical field, you know, like if you have like an office job, you always have someone on top of you. But anyway, in the hospital setting, there is a hierarchy. Let's see. Let's type down. Oh wait, there is a hierarchy. Let me open MS Paint. I think it's better if I paint. Oops. I'm gonna draw the hierarchy. Okay, because this is like a trivia, like a not really a must know, but it's something to keep in mind. Where's my pen? Where's my pen? Janitor meta job. Okay, we're gonna stick to hospital hierarchy when it comes to, like, you know, in the clinical division or in the medical, in the, you know, the ones who really work in the medicine. We're gonna talk about doctors, okay? So nurses in the hospital field, they have their own hierarchy as well, but I didn't take up nursing, but I think it works similarly. There is a hierarchy also in nursing, and yeah. But we're gonna focus on like the side of the doctors, because that's where, I mean, yes, that is my specialty, and that's where. All right, let's open up the MS Paint. MS Paint. Ha! Look at my MS Paint window. Okay, open that. Okay. Let's see, we're going to go for, let's use black, let's use this color, dark red. We're gonna use dark red. Okay. Oh. Okay. The hierarchy. Alright. So, MS Paint. Yeah, MS Paint is the superior software. You can never go wrong with MS Paint. Alright. So, let's start with the lowest of the low. In the medical field, we have a hierarchy, okay? If you're in med school, if you're in med school or you're going to go into med school, okay, I'm gonna call you guys red, or I don't know, I'll call you guys brown, okay? Once you hit your 4th year in medical school, you'll be entering the clinical. So in medical school, you have like, it's 4 years, okay? In the Philippines, it's 4 years. It may be different in other countries, so I can't speak for other countries. And, oh! Si Maiko nandito! Hello, Maiko! Thank you for the sub! Si Maiko nandito! I just noticed si Maiko pala yung nagsabi, MS Paint Superior Software. Hindi ko napansin yung pangalan mo. Thank you for subbing. Okay, we're gonna start with the lowest of the low. I'm gonna color you guys brown because, you know, you're the dirt. You're basically the dirt everyone shits on. When you enter med school, you're going to go through, in the Philippines, there's 4 years of medical school. First year, you learn basic stuff like anatomy, you're gonna go through biochem, physiology, what else? Patient-doctor relationship, what else do they have? Whatever, basta, magaganon, basic subjects. And then when you enter second year, you're going to have like part 2 of the basics, and then you're gonna start entering the more specifics. Like, you're gonna start entering the specialties. There we go. Especially third year medicine, you enter the specialties already. You start learning about that. Okay? Now, once you enter, and in third year, this is when, since you're starting to learn about specialties, you're going to start, like, slowly dipping your feet into the clinicals, okay? So, like, while you're learning, you know, studying your textbooks and, having classrooms, you're going to start having, meetings with some doctors, depending on the subject, and then you're gonna start talking to patients. That happens in the third year. Then you're gonna start learning how to take your, history and physical examination. Yeah. Okay? But once you hit fourth year, okay? Fourth year, let's color it, fourth year. Fourth year med school. This is Philippines, okay? I don't know how it is in other countries. Fourth year. Once you hit fourth year, you are going to be called a junior intern. And here, it's not classroom setting anymore. You're not classroom setting. You are the lowest of the low. That's why you're here. You're pretty much shit. You are shit, okay? You are the dirt everyone works on. Junior intern, or they also call this clinical clerk. Clinical clerk. Fourth year. Okay. So what do you do as a fourth year med student? You don't have the classrooms anymore. You don't have you don't have the ano to? You don't have well, you read your textbooks, but you don't have classrooms anymore. You're going on duty. You're going to the hospital. You're there. You're immersed in the hospital. You're gonna be going around you're gonna be doing rounds. And you're going to be doing some minor procedures like inserting the NGT, nasogastric tube, inserting Foley catheters, IV insertions, and all that. Everything! Everything! So what does a clinical clerk do? The reason why I say you're the dirt everyone walks on, because you're doing all the scat work. You're doing, let's see, you're doing NGT insertions, which is basically putting tubes in patients' noses that goes into the into their stomach. So NGT insertion. You also do Foley catheter insertion. You start doing these things. IV insertions, all that. You're the one who's gonna be like what is this? Utusan ng mga senior. Utusan! You will be commanded to do things. Do this, do that. Servants. Okay? Servants! Yes, you're the servant. Okay. Actually, yeah, basically, scat work. You're doing, like, the grunt. You're like the grunt. You're doing the grunt work. You're the imp. You are the lowest of the low. If someone says, if your more senior says, gawin mo to, bigay mo to sa ganyan, bigay mo to, give this to the radiology department. Refer this patient to the radiology. You're gonna be writing down everything. You guys are the ones that write down the forms. Okay, there's a reason why you're called clinical clerk. You're also gonna be like filling up forms. Fill up forms. You know, the history and PE forms. That's what you guys are gonna do. Okay? At least they got paid. Ha! You're still a student. You don't get paid doing this. You're the one paying for your tuition. Okay, this is still a student. You're a 4th year med student. You don't get paid. What are you talking about? That is why I say you're the slave. You don't get paid. You're still a 4th year med student. You're not a doctor yet. You're on the road to becoming a doctor, but you're not a doctor yet. Okay. But they will call you doctor, doctora. Doctor, yeah. Yeah, you don't get paid. This is like, on-the-job training, but, yeah, you don't get paid at all. You just do all these things. Okay? I thought nursing aid and students are lower than clerks. Well, students are, but, you know, this is, I'm talking about doctors here. In the hierarchy in, the doctors, okay? Nurses are not included here because they have their own hierarchy. Okay, that is separate. This is separate, man. Yeah, you're the one paying because you're a student. You're still a 4th year. The 4th year med student is the last year. So, this is a junior internship or clinical clerkship is like required. You don't get paid. This is your training. It is training to be in the harsh world of the hospital. Okay? Thank you for the sub, Rub Champ. Right. What is next? So yeah, it's really grunt work. Okay? You don't get paid. You have to go in the hospital every day. Straight. Every 3 days by duty. You go to you have a duty every 3 days. That's how it is here. Like, there is this thing we call pre-duty, from duty, and duty. Or, here, let me write it down here. I'm gonna tell you guys, so you guys know what it means when, there is duty. Okay? In the residency. Or in the internship, okay? Pre-duty. Duty. Post-duty. When you say pre-duty, you go in at a set time. So this is like office hours. So office hours. When you say duty, this is when you extend until the next day. Till next day. Okay? Post-duty, this actually carries over to post-duty. So your duty is like the whole day plus the nighttime. And then when it's the next day, it's post-duty. So it's like office hours. This is why when you say duty, it pretty much... When you say duty, it's pretty much this... You're in the hospital, like, this long. So if you're duty, like, 6 a.m. or 8... You go in 7 a.m. I don't know, whatever time they start. Usually it's until office hours, but you stay the night, and then you have to go in... You know, you basically stay in the hospital for more than 24 hours. That's what usually happens. Yep. 24 hours, those 12 hours. Yeah. That's how it is. Okay. So imagine the stress these 4th year med students go through. Because this is like the transition period. 3rd year is a transition period. And 4th year is when these the junior interns are starting to learn how it is in the hospital. So, the stress levels, man. Okay. Now, the next level, let's see. The next level is a bit higher than a junior intern. Okay. You're not really dirt anymore, but you're just shiny dirt. You're not dirt anymore, but you're more like sparkling dirt. Which is, if there is a junior intern, there's a senior intern. Yay. Senior intern basically does everything the junior intern does. But this time, you have little... may utusan na kayo. You're a senior intern. You do everything that a junior intern does. You rotate in different departments, but this time you're more experienced. And this time you have little junior interns to boss around, and the junior interns will be looking up to you like, "Oh, senior intern! They graduated med school. They're so cool." Yeah. Or postgrad. The other name for this is like a postgrad intern, PGI. Postgrad intern. Okay. This time, senior interns are those who graduated med school. Okay. Those who graduated med school. So they have the MD. Wait. I mean, when you graduate med school, you have the MD, but I mean, you have to take an exam to actually be a practicing doctor. And to do so, you need to take senior internship before you take your exam. So, after junior intern, you graduate, and then you become a senior intern, which is 1 year of being in the hospital you want to be in, working there, being a servant. You're like this time you get paid, but like it's so small. You just get a stipend. You don't really. This one you don't really pay anything, but you get a stipend, and it depends on the hospital how much you get, but it's not much really. It's really not much. I'm curious, how do y'all cope with the stress? Me, personally, when I was a senior intern, I just played video games. I just played video games. You get stressed out a lot, but you find ways to find out how you find ways to cope with the stress. I just played video games that time, and whenever I had free time, I just hung out with friends. With the little time I had, I was able to find time. Minsan wala kaming stipend. Okay, some people don't have stipend. Oh my god. Are you serious? Some senior interns don't have stipends. Anyway, yeah. Flirt with co. Yes! Basically, that's what some senior interns do. Alam mo yung mga single. If you're single and you have a little junior who looks hot, that's what they do. They flirt with their juniors. But anyway, yeah, this is you're not dirt anymore, basically. You have earned your, right to be a senior intern because you went through junior internship, you know the hell and everything. Alright, next. The hierarchy, what is next? Next one, let's make the next one orange. Okay. After senior internship, let's make it orange. You take the licensure exam. Okay. You take the licensure exam, and if you pass, you are officially a full-fledged doctor. That means you can practice. Okay? So that's after senior internship or postgraduate internship. You take the exam, and then you can, you can branch out. Oh, wait. How do I erase this? I should erase this. Hold on. Okay. You can this can branch out, actually. So, from senior internship... Oh, what? From senior internship, let's branch out to... You can be a GP or a general practitioner. Which is a doctor that, with no specialty. They're doctors, but they don't have a specific specialty. They can treat patients. They do referrals if like a patient needs a specific a specialist, then they refer to a specialist. Okay. So these are usually the ones that hold clinics in places like usually these are the ones that hold clinics in like companies. I think those are usually the GPs, like or a general practitioner, like in company clinics or hotel clinics or whatever. Those are like GP. They have the license to treat. That's one. And I think usually it ends here. So you earn money, whatever, how many, what's this? The money you earn is based on how many patients you see. Or, no, not really just how many patients you see. It's like hourly. The next one would be, specializing. Okay? This is a specialty. Specialty. Okay? Residency. You can become a resident. Resident. This right here is a resident is basically a doctor in training for a certain specialty. So these are the ones you see in hospitals that do rounds all the time. Okay? These are different from like junior consultants or consultants, okay, that also do rounds. These ones are actually like in training. They are like, for example, you can have different kinds of residents depending on the specialty they want. Like if you have they have like IM, internal medicine, OB-gynecology, pediatrics, what else? Neurology, surgery. Okay? And for each specialty, there are how long it takes, it depends on the specialty. Like you can like have let's see, there's IM, this is internal medicine. You can be pediatrics. There's orthopedics, ortho. They have different kinds. There's also radiology. There's ER. There's surgery. There's a lot of specialties. OB-gyne. Okay. And there's a lot. There's also pathology. Pathology. There's like a lot. And for each, if I remember correctly, I think internal medicine is 4 years, so you're gonna be 4 years residency. Pediatrics is 4 years ba? No, I think 3 years. Am I right? I don't remember if internal medicine is 4 years or 3 years. I think it's 3 years. 3 years but 4 years. I don't know. 3 or 4 years. Pedia is, I think 4 years. Not so sure. Ortho is 4 years, I think. Radiology is 3 to 4. I don't remember. OB-gyn is 4 years. Pathology is, I don't remember. ER is 4 years. Surgery is actually long. The surgery is actually 5 years. 5 years. Okay. Anyway, either way. So, the thing in residency, when you're a resident, there's also like a mini hierarchy there. So aside from the one I'm mentioning, the hierarchy I'm talking about here, there is also a hierarchy within residency. And I will get to that. Okay? I'll get there. Okay. Let's go here. We're gonna talk about the hierarchy in residency. First, second. Let's talk about surgery since I'm a surgeon, and I'll tell you guys 4th, 5th. Chief. Okay. So, in residency, they also have their little hierarchy there. Okay. You have the first year that's pretty much like that does the grunt work also, but unlike junior intern, see they earn money. These are the ones that do the heavier work, this heavier physical work first year. Okay, and there are like mini rotations also for each year level. So usually first year, I think this applies to all the other residents. They do like ward work or floors work. So these guys stay in the wards. Second years, I think they stay in the ER. Third years depends. I think in other specialties, some are ER also, and they do wards. Fourth years are just ward work. Same with the fifth years. Fifth year ward. Now, there is a hierarchy here in that you have to respect your senior, okay? So if you're the first year resident, you're like the dirt of the entire resident. You're like dirt, basically, to your senior. You have to respect your seniors. If your senior resident tells you, oh, you gotta do this, then you gotta do it. I mean, if you guys remember that show I was showing you guys before, ano yan, yung Abot Kamay na Pangarap? The one with the neurosurgeon. That show basically shows how residency is like. You know how, what's her name? Ano pangalan ng bida dun? What was her name again? I forgot the name of the main character in that show. The main character in that show started as a first-year resident. Yeah, right? And you see how she gets bossed around and bullied, kinda bullied. It's like that. Abot kamay naman, yep. Abot kamay na pangarap! Well, actually, I think... Okay, here's the thing, guys. Here's the thing. You know the bullying stuff? It can happen, actually, because of the hierarchy. It can happen. And I think some hospitals or some, residents are trying to, like, take that bullying part away because, like, if I remember during my residency, I have seen a lot of shit. Oh man, I have seen how I have seen in other, even as an intern, I have seen how other seniors treat their juniors, and it's not pretty, you know. Especially in surgery, it's very tough. You know, surgery is a male-dominated specialty. So they, you know, when you look at the guys, parang, kailangan matapang. You know, nagpapakita ng tapang. Talaga may bugbugan pa na nangyayari. It's happened before, but it's reduced. I mean, they don't really do it anymore now. That kind of thing is not like... I don't know if they do it in other hospitals, okay? But, you know... In other hospitals, they don't do that shit anymore. I am lucky that my seniors were, most of them anyway, were nice. But anyway, yeah. So, for those who are in med school right now, taking the PLE, I want you guys, and then if you're planning to take residency, just be prepared for what you are going to be faced with when you will become a junior resident, okay? Expect to get a lot, to be stressed a lot. Expect the grunt work. Expect to be doing a lot of heavy work. But, you know, once you're done with your first year, you go up. There's a hierarchy, like I said, there's a hierarchy. You go higher up, the workload gets lighter. There's the thing about residency, or the hierarchy here. You get all the grunt work as a junior or as someone lower. You do all the heavy stuff, the nasty shit, the tiring, physically tiring, probably even mentally tiring stuff. But as you go up in the ladder, the work gets less, or the load is less. But the load is less, but the responsibility becomes heavier. So there's like a balance. There's a balance. Like, if you're a junior, your responsibility is a lot less than that. Like, if you're a first year, your responsibility is a lot less than the responsibility of, let's say, the most senior, the 4th year or the 5th year. And that's a different kind of stress, actually. The stress of the junior is a lot more different than the stress of a senior. Okay? That's how it is. That's why when I got higher in the ladder, especially after resident is the consultant, okay? After resident is the consultant, so the responsibility is even heavier, okay? As a consultant. So after resident, let's go here. Consultant. Consultant is like the final, you know. These are the ones that hold clinics. Okay? Some consultants also go on duty if they wanna, you know, especially surgeons and ER residents, they actually go do duties. Some are just do clinics, okay? So once you're a consultant, you're already there. You have stable income, you're ready, you're good. You have stable income if you're already getting patients. But yeah, the responsibility is even heavier because this time, you know, you're not in training. You're done. You're it already. You are a doctor, full-fledged doctor done with all your training. So the responsibility is a lot heavier. So this is the final goal. The final goal of the hierarchy. Yeah, you're on your own. Unlike here, see, in residency, you start as a junior, you have people looking after you. You have your 2nd year, your 3rd year. So as you go higher, the workload is lower, but the responsibility gets higher. Was it not what do you mean a staff? Technically, if you're in residency, you are a staff. But as a consultant, you're not. You can have your own clinics. Okay? So that's the highest. There's also some like after residency, let's say if you finished residency, there's also something called fellowship, which is a subspecialty. Like there's also fellowship here. Let me put this fellowship, which is like further training, but then you're basically treated like a consultant already. This is for subspecialties. Like, for example, internal medicine have different branches and different subspecialties, like endocrinologists or cardiologists, gastroenterologists, so they have to enter fellowship. And I don't know how many years that one takes. Do you have a kind of test at the end of residency? Yes, there is, actually. Once you finish your residency, you have to take this a board exam again. You have to take a board exam to become like a fellow of the Philippines. Well, here in the Philippines, to become like a fellow of or to be able to really practice your, you know, to really practice as the specialty you chose. Okay. It's a board exam. So imagine all the stress these But once you're a consultant, you're done. That's it. That is the final goal. Yeah. There is also an exam every year for a resident. Like it's a national exam. Like each year there is one, and then at the end there is another one. I think for surgery, if I remember correctly, surgery has like used to have one, but now it has 2 exams. Yeah, it's like proving that you can practice in that specialty. So yeah, fellowship is basically someone who finished residency and is able to be a consultant but decided to subspecialize even further. So yeah, like I am, like I said, there's endocrinologist, gastroenterologist, nephrologist, hepatologist, surgery. We have different subspecialties too, like hepatobiliary, breast surgery, minimally invasive surgery. I think there's one for robotic surgery, but we don't have that here in the Philippines. There's also vascular surgery, TCVS, thoracic surgery, and all that. Urology, there's many. Pathology, I'm not sure if there are subspecialties for that. Pediatrics also has some subspecialties. And I think ortho also, but I don't know if they have to go through fellowship. I'm not sure about ortho. Radiologists, there's like interventional radiologist, intensivist, or I don't know, MRI. I don't know. There's also subspecialties for radiology. ER, I'm not so sure. And OB-GYN, I know there's like gynecologist, like oncologist, gyne-oncologist. How do they do this board exam, practical test, or... It's written! It's written, and I think... It's written, and in surgery, they also have, like, oral exams. So you have to, like, you're in front of a panel. I don't know how it is in other specialties, but it's also written. So, usually, in our case, it's multiple choice exams. Okay. Regarding responsibility in the hierarchy, if someone under you messes up, doesn't mean you'll take the blame as a superior. Yes! That's why I said the responsibility is a lot heavier. This is why, see what happens is the consultant is the boss, okay? They're the ones who teach us they're the ones who teach the residents the craft of being whatever specialty they chose. So... The first years, of course, you know, they're new, they don't know much yet. They're still learning, they're doing the stat work. It's a responsibility of those seniors to be guiding the first year in the same way. So like the second year, the third year, fourth year has to be guiding the first year. Third year, fourth year has to be guiding the second year, you know, and so forth, so on. So if a junior messes up, of course the junior gets a blame. The junior will get blamed. But at the same time, they'll be like, sino ba nagturo sa'yo? I mean, who told you? Isn't anyone watching you? And then they will just go straight to the senior, like, aren't you teaching your junior the right stuff? Why did your junior do that? Yeah, you know, you end up being responsible. That's why. Okay, so that's how the hierarchy works in residency. So for those who are taking medicine, med students, if you want, you can choose to become, you know, once you graduate medicine, you become a senior intern, and then you take your physician licensure exam. You can either go become a general practitioner, which is making clinics and earning hourly. Or if you wanna, you know, if you wanna specialize, you go into residency, but be prepared for the grueling years you're gonna have to go through. Years of training. Okay? It's kinda hard at first, especially when you're first year. A lot of first year residents tend to, like, give up because of how tough it is to be in residency. It's not easy, actually. Because the stress levels are pretty high. But, yeah. Not all is multiple choice. A law student watching this is a form of copy. Are those memes of the choices sounding the same real? Oh, yeah. Kinda, because when they do exams, it's choose the best answer. So, like, they could all sound like the correct answer, but you gotta choose the best. It happens. Like, they give you, like, for example, this patient came in and had was stabbed in the chest or something like that. What is the first thing you're going to do? And then they're going to, you know, they're gonna give you a list of stuff, like, insert IV fluids, intubate the patient, something like that. And you have to choose the best answer. Sometimes all of them look right, but, you know, there is a best answer among all of them. So most likely the so-called responsibility is shouldering the blames of the... Yeah, basically that's how it is. That's how it is. So the consultant will be like, why is your junior like this? Talk to your junior, blah blah blah. Bakit ganun? You know. That's how it is. So, let's say, so for example, okay, we're gonna clear this up. I'm gonna clear this up, okay? How do we clear this? How do we, like, erase everything? So, like, ito na lang. Oh. There we go. Oh. Okay. So, let's say you get, so let's say, so now you know about this. Let's say you go to a hospital, right? Let's say na ER ka. Let's say you got, in the ER, especially I think, is most, seen in, let's say PGH ka. Let's say PGH. Okay? I think PGH is like the largest Philippine, no, not really, the largest public hospital in Manila. PGH. No, I don't want to say PGH. Forget PGH. I don't want to say PGH. Wag na. Let's say you're in a hospital. You're gonna sabihin PGH. Baka may taga PGH dyan. Baka maano ko. Baka maano pa ako. Let's say you've gone to the ER for, you're going to the ER because your stomach hurts, okay? ER, I'm in the ER. You're going to the ER because my stomach hurts. My stomach hurts. Apex. O sige, let's say you go to Apex Medical Hospital. I'm not from PGH, okay? That's baka isipin nyo taga PGH ako, hindi ako taga PGH. Pero marami akong kilala sa PGH. Okay, let's say you go to Apex Medical, okay? Apex Medical, you're going to Apex Medical Hospital. Apex, let's put this. Apex Hospital. Let's go to Apex. My stomach hurts. Okay, you're going to Apex. And then you're going to be, you're gonna go through the triage, and then they put you in the beds, okay? They put you in the beds. You're gonna be seen in a training hospital. You're going to be seen by a doctor that probably looks very young, probably your age, okay? Maybe slightly older. Like a doctor in his or her, you know, early to mid-20s or something, whatever. You're gonna see that they're usually residents, okay? And they're the first doctors to see you. They're not consultants most of the time. Consultants are like, those who, like I said, those are the ones who finished, but usually it's the residents who will see you. So, you can just, if those residents seem to be literally, you know, snap at you, because I get this, I see this a lot. Okay, I see this a lot in Facebook, like, doctor shaming. Sabihin nila, ang bastos ng doctor na to. You know, you know, I can, like, go to a random hospital page in Facebook and then go to the reviews, and then you'll see, like, random people saying, wag kayo pumunta sa hospital na to. Don't go to this hospital. Ang bastos ng nurse at doctor dito. Sumisigaw. Yeah. I think that usually happens in public hospitals. That usually happens in public hospitals. Now, I can't blame them, but at the same time, I can't really blame the doctor or the nurse at all. You know why? Because if you're in a public hospital, if you're from the Philippines, you know how shitty in general it is here. In public hospitals, there's like one nurse for every several patients. Sometimes it can be one nurse to 20 patients, okay? Or sometimes one nurse to like, let's say 15. Okay, so they get tired. It's terrible, okay? So in the same time, resident doctors, sometimes there's only one resident or two stationed at the ER. And they handle a bulk of the patients, okay? Like, let's say you handle 25 patients. Yeah, that's how it is, at least here, okay? Probably in other countries it's not as heavy, but depends. It depends. It really depends. So, usually they might end up snapping. So if a resident ends up snapping at you, it's usually because they're so exhausted. But yeah, they shouldn't really be snapping at you, but at least try to understand that, you know, they are tired. Because they have to handle this much. I mean, most of the time they try to keep their cool because, you know, you gotta maintain the professionalism. But when I see reviews like that, of course I don't know the whole story. There's a bed. This is a patient bed. Patient. Ang bastos nyo po. Ang bastos nyo. Yeah. Sometimes it's just they're really tired. Of course, they shouldn't snap back at a patient either way. I always see also, Oh, I know one. This one is common. Okay, this one's common. Resident ER. Okay, resident in the ER manages another patient. Let's say you have your stomach hurts and then you see the resident. But the resident pays more attention to this one because his problem is I can't breathe. Okay? I can't breathe. Of course, sometimes the complaints in those pages, they would be like, hindi ako pinansin ng doktor na yun. Ganun, ang dami-dami nila pero mas pinansin niya yung isang pasyente doon. Okay, the reason why if a resident doctor takes a while to look at you, it's because he's looking at someone else that is more urgent like this. If your stomach hurts, the more urgent one is someone who can't breathe. Ganyan basta gura. Yeah, priority. So, imagine if you have one resident to a lot of patients. They will have to prioritize the ones who are more critical. So, some people don't understand that. Okay. And yeah, sometimes it can't be helped. It can't be helped that there's only like one or two residents that handle a certain number of patients. That's how it is. It's not that it can't be helped because, you know, that's how the system is. As much as we want to have more people manning, you know, like for example the ER or wherever. Yeah. It's a government problem. Unfortunately for us, man. So this is like a public hospital setting, okay? The public hospitals. It's like this. If you're in a now let's go to private hospital, okay? Let's try talking about private hospitals. Okay. In private hospitals, the patients there are a different breed. Patients in private hospitals are a different breed, okay? Usually, instead of, let's say private hospitals, start with blue. Sometimes you lack medical supplies in the public hospitals. Yeah, it is. It's like that here in the Philippines. This is why I help some of my patients, because there's some medical supplies that are not available in the hospitals. In one of the hospitals I work in, so I have to help them out. That happened when I visit PGH. What happened? Let's say you're in a big, you're going to a private hospital. You're a person. My stomach hurts. Okay, you're going to a big hospital. Kung kanina public hospital, Apex, Super Apex Hospital. Yan, ha? You're going to a private hospital. Expect that in because private hospitals are more self-sustaining. They have money. So they have a lot of the facilities needed that government hospitals don't have. So expect here the ideal care. It's the reality, okay, compared to public hospitals. Private hospitals will give you the best or ideal care. But at the same time, you get the best, you get the ideal care, but also you get it's expensive, okay? It's expensive. So that's the reality, unfortunately. And not everybody here in the Philippines can afford the Super Apex Hospital. But if you want the best of care, because you know it's only the best because they are everything that's needed is available there, and you know, of course, it's more comfortable because it's a private hospital. So you go to a private hospital. Now, just like in the private hospital, the difference between this and public. In a private hospital, you will be first seen by a resident also. Okay, so after the triage, you'll be seen by a resident. The same thing happens, okay? The difference between private and public hospital, in private, there's a consultant that will always be there, okay? So you'll be seen by a resident. Unlike in government in public hospitals, most of the time the residents are left in charge, and what they do is they just relay to the consultants. But in private hospitals, because it's a private hospital, a resident would relay to a consultant, and then the consultant would take charge. Take charge. Okay? Like, lahat ng sabihin ng consultant, the resident does. Unlike in public hospitals, it's more like the resident will tell the consultant about the patient. The consultant will listen to what the resident has to say. That's part of training. Okay. More like the consultants are more hands-on. I don't know how you say it. No. The residents are more hands-on in public hospitals compared to private. Do people need to pay for something in public hospitals? Yes! I mean, not everything is free. They pay like a portion. Okay. It's the bills that actually make your disease worse. Yes, actually. In private hospitals, the consultants, while it's the resident that does rounds on the patients every day, the consultants also do, because it's a private hospital. Unlike in public hospitals, consultants can do rounds only like a few times. The residents are the ones you see almost every day. Is there no law being pushed into PHH to prevent hospitals from overloading nurses with patients? That's kind of difficult because it's actually a governmental problem. We don't, in the first place, the medical system here is poorly supported by the government. Okay, it's been like that for a long time, so it's kind of hard to, like, you know, for them to push a law to prevent overloading when they themselves can't, you know. This is me getting political now. When they can't provide. So that's for public hospitals, okay? In private hospitals, everything is good, okay? Well, not really everything is good, but, you know, it's not as overloaded. There is some overloading, but not like in public hospitals. The public hospitals get really get the shit. And yes, public hospitals, you know, see, the reason why public hospitals have more hands-on is because, you know, majority of the people in the Philippines cannot afford super apex or private hospitals, okay? A lot of the patients are they go to a public hospital because they can't afford, so that's why. That's why there's a lot of patients more that go to public hospital. I mean, what can you do? Tell a critical patient we're full getting yes. Yeah, that, you know, that actually, you know what? Actually, that happened during COVID. You know, when COVID happened, that was actually hell for the country in a way. Especially in the medical field, the stress levels of a lot of doctors, including myself, increased because of that. Because there were hospitals that couldn't accept patients because they were full. Like, totally full because of COVID. It's happened, actually. Like, I'm sorry, we can't accept you because we're full. You have to look for another hospital. And then that patient will go to another hospital and they would say the same thing. We're full, you have to try another hospital. That happened. We're full, get to another hospital. It has happened. And that was during COVID. It was terrible. I think we had the same thing happen to us. Like, I think we had, like, when during COVID, like, at least I didn't do it, but someone else had to. Like, it's usually the nurses, the triage, that has to do that, and it's really sad. Yeah, first year of COVID, it happened. So yeah, it's really hard on our part to, yeah, it's really hard. It's something you don't want to do, but you have to do. And it's kind of heartbreaking when you do that. Fortunately, I didn't have to say something like that, but it, you know, I can imagine the nurses or in the triage that had to do that. It's kind of heartbreaking. What else? Speaking of COVID, yeah, that was really stressed. That was stressful times, especially during COVID. I just remembered something. Wait, I just remembered something. I'm gonna go to. I think we're done. We're done with the board. Let's go. Okay, yeah. I can only imagine how it feels to refuse to help people. Yeah. I just remembered something, like, it happened, when did it happen? 2021 or 2022? Last year? Maybe I can probably talk about it now. But during COVID time, I think it was like late 2020. I think it was in 2021 when this happened. Not 20. Yeah, I didn't know if you guys followed me on Facebook for a long time, probably have seen this happen, this incident happen. I did get into a clash with someone on Facebook. So, because it actually pissed me off when I read it. I couldn't help myself. I don't know if you guys remember it, but oh, Scorpion, thank you for the sub. Someone on Facebook, I don't know if it was 2021 or 2022 or last year. I think it's 2021. This is during COVID, right? Someone posted on Facebook that he went to a hospital. He started ranting on Facebook. No, it was not a Tuli discourse. He started ranting on Facebook about... He was so pissed off, okay, that he went to a hospital. I think... I don't... Is it a private hospital? I think it's a private hospital, but it's not like a big private hospital. It's not... Nothing like St. Luke's or ano bang private Makati Medical Center or yung mga ganun, like big hospitals. It's like a small private hospital. Teaching hospital, there we go. He went to a hospital because he had his abdomen was painful. He had a stomach ache, if I remember correctly. And he started complaining because the doctor there was mean to him. Doctor was mean to him or something, didn't pay attention to him, and said something like he was being judged because of what he was wearing. I don't know if you guys saw that, okay? But that pissed me off because when you look at the comments and what he said, he was so angry that this is what pissed me off. He said, sana ma-COVID yung doktor at mga nurse na yan. That's what he said. He said that, and that really pissed me off because during that time, a lot of doctors and nurses were dying from COVID, and that pissed me off so much. I didn't reply to him, yeah. I made a separate post. So if you guys were following me on Facebook during that time, you would have seen that. Yeah. It was a long post. He said that, yeah. He was, if I remember correctly, he was saying that the doctor didn't want to, the doctor judged him for what he was wearing. Para akala nila pulubi ba siya? He said the doctor probably thought he was poor or something. Because he judged me how I looked and was telling me that this imaging that he's requesting might be expensive. And he felt offended by that. And I was like, what the hell? You know, as doctors, we kinda have to judge the patients we're looking at. Because, you know, there are more poor patients than capable patients. So, we have to see mukha bang may kaya or what, you know? We have to know if they look like they can pay for this because, you know, we might request it and then they'll be like, oh no, we can't afford this. I mean, it's not like we're judging to be, you know, judging in a bad way. We're judging to see how we you know, if you can afford, because that's how it is. It's a system. We can't really. It's not that the money's not even gonna go to the doctor. It's gonna go to the hospital, and it's not really our fault. Yeah, because I've had patients who really, you know, I would request for like if they need an MRI, and an MRI is really expensive, and they would like ask me, wala bang ibang paraan? Wala, hindi ba pwedeng iba na lang? You know, something like that. Like, or a CT scan is more expensive than an ultrasound. Sometimes, because the ideal is to do a CT scan. And if they can't afford it, then we use a ultrasound, so, you know, something like that. Duck, can you explain why the cardio lad and the nephrology nerd are always arguing? I actually don't know why they would argue. I can say, if any argument I can tell you about, it's the argument between a surgeon and an internal medicine, or no, surgeon and an ER doctor. That one, yeah, we argue a lot. Surgeon and ER doctor will argue a lot. Cardio nephrology, I would say it's probably because of the management and, you know, the what would be the actual causes of a person's disease. I mean, cardio-nephrology can be a cause of, cardiac problems and kidney problems can be the cause of a certain disease, to be honest. The doctor is only looking out for the person. I mean, imaging does cost some, it's just transparency. Yeah, pretty much it's like that. So, that person in that post was like, he actually said that. It pissed me off. I made a post about it. And then he got angry that I made a post about it. That person got angry that I made a post about it. And I was like, what the hell, man? But, eventually he blocked me and I blocked him, so... I don't want to read his shit. It was really, bad. It was bad. Do doctors come to blows and... What do you mean, like, come to blows? Like, beat each other up? They don't really know. You can't beat each other up in the hospital. You gotta be professional, man. You'll get, like, kicked out. Sometimes even lose your license. I feel like there would be some argument between nephrology and infectious disease. There would be an argument between ER and surgical surgeons. There would be an argument between ER and other specialties. Especially ER. Everyone fights with the ER, to be honest. Especially surgeons. That's how, yeah. I hope I didn't, like, discourage anyone, taking medicine about residency. It's something you have to go through. So, it's just something I'm telling you, just so you guys can prepare yourselves. Like, residency is tough. Not many people can make it through the first year because it can be it's really stressful. I will not deny that. But perseverance is the key. Perseverance is the key. You just gotta find a way to, like, find time or a way to, distress yourself. I mean, a simple massage is a good one. Like a nap in between your, even if you're, like, let's say you're on duty for, like, 24 hours. Okay, you're at work. You're a resident, first-year resident. You're handling the entire hospital for 24 hours. There is no way, that you are, totally doing something for 24 hours straight. What do I mean? You will find time to actually, because, you know why? You will find to look at your phone and look at Twitter or something, or Facebook, or post a TikTok video. That means you had, like, small time to do something to relieve yourself of stress. Okay? So, there is always time, even if it's small. And, use that time to, like, take a small break. So if you're in residency, it's because residency is really tough. So even if you have, like, a short time to, like, distress yourself, like, make use of it. Just do it. Like, okay, I gotta stop. Like, you're working, you're doing rounds, writing in charts. It's okay to stop and pause for a bit or take, like, a 5-minute power nap. I mean, I did that when I was a first-year resident and doing rounds. It was tiring as hell. I would sometimes get only an hour of sleep during a duty night. But, I would take power naps. I had to adjust my body. If I had to, some people would just buy coffee and drink coffee, Starbucks, whatever. I would find ways. What do you do to keep yourself awake? I drink a Monster energy drink. I drink Monster. Other people drink coffee. As a nurse, it helps you understand who and what kinds of residents are around you, so thank you for the knowledge. Yeah, you'll see different kinds of, residents. Some residents, well, I won't deny, some residents can be assholes. I mean, not all residents are nice. A lot are nice though, but there's probably like a special few who are total assholes. Yeah. But most of the time it's because they're stressed as hell. Is there a choice of which hospital a person can learn in, like public versus... Oh, okay. Here in the Philippines, you can choose where you wanna train. So what are it's up to you what you want. So private versus public. So if you want the comfort, and security, you go to private hospital. But if you want to be exposed more to, like, exposed more to the common diseases, or, like, the poor people, the poor people, yeah, pretty much the majority of the patients. But the sacrifice would be that the management or that you provide will not always be ideal. Then you go for public. There's a pro and a con. Like, private hospitals, you can give the best care you can, ideal, part of the guidelines or whatever, but you won't be seeing much of the reality of patients who can't afford that. Unlike in public, where you can't really give the best of the best, but you give the best that you can, you'll see, like, more patients. It really depends. It's up to you. Personally, I went for a private hospital because I wanted the comfort, but at the same time, they have outside rotations. Some trainings have, like, outside rotations, so you're exposed also to, like, public hospitals. I just watched some med student bungle IV insertion 3 times in a row before a nurse stepped in. The student had no supervisor close. Anyway, what level? What do you mean by what level? If it's a med student, it's probably a 3rd year or a 4th year med student. IV insertions are... The best in IV insertions are the nurses, okay? This is one thing. Sometimes in hospitals, okay, the patient will be like, I want the doctor to insert my IV line. They would be like, I want the doctor to insert the IV line. Patients think that the doctors are the best in inserting IV line. You're never. If you become a patient and you're scared of needles and scared of being pricked, please, I am telling you, and tell your friends and tell your relatives, never ask. Do not say or tell the nurse you want the doctor to do it, because you're just you're just in for more suffering. Never say that. You know why? Because the best people to insert your IV line is the nurse. Okay. The best person to insert your IV line is the nurse, not the doctor. Do you know how many... And I'll tell you why. Nurses are in the hospital like at least 8 hours a day or every day, depending on their shift. Depends on the shift of the nurses. And they do rounds every time. They handle many patients. Do you know how many IV insertions a nurse does in a day compared to a doctor? Okay? A doctor will probably do an IV insertion like once a month, or like, let's see, like 10 times in a year. A nurse has done an IV insertion like multiple times a day. And then you see this patient come in and like, I want the doctor to insert my IV line for me. That happened to me. Like, the nurse would call me and say, Doc, gusto niya kayo po mag-insert ng IV. I'll be like, are you fucking serious? Are you fucking serious? Is he asking for suffering and pain? Oh my god. Patient just wants to live dangerously. Yes, leave the IV insertions to the nurses, okay? Don't ask for a doctor. If you ask for a doctor, you're just asking for hell to happen. The doctor's probably just gonna be like, give me a livey light and just prick you and doesn't really care. They'll probably just miss you on purpose because they don't want to do it. I mean, I do my best, okay? But I'll be like, I'm not good at this. The doctors just don't want to tell you. Most of the time, sometimes you just don't want to tell you that, you know, the nurses are actually better than us at this. It's just, you know, we just don't want to say it. But in our minds, we're gonna be like, what the hell is this guy? Why is this guy asking me to insert his IV? That's very insightful. I should be observing. Yeah, nurses are better at doing IV insertions. They are trained for that. They go through training for that. Doctors go through, like, training for that, but, like, in med school. And that's our only training for it, to be honest. We just go through it in med school, and then that's it. I think nurses have training for that, and they even go through workshops for that. We didn't have that. Okay, I didn't have that. I just had, like, we have IV insertion in, like, med school. And then that's it. And then our practice was just, like, in 4th year med school, where we just insert IV lines. And then that's it. That's all the training. After that, when you're done with your junior internship, you don't do it anymore. You don't insert lines anymore. That would be like the last time you insert an IV line. And then you're gonna start asking your doctor, what more kung consultant pa yung mag-i-insert, no? Consultant, ilang years na. The consultant probably didn't even insert an IV line for like 5 years or something. If I heard that from a patient in my mind, I'm like, okay, if you really want that. Yeah. Sorry, ma'am, nagkolaps ang ugat. Pahinga na natin 5 minutes. Doctor, I hope you have one hell of an insurance. Yeah, like, that's funny to hear, you know, when they, I had multiple patients that, like, the nurses would call me, before, they would be like, Doc, kailangan na, kayo po ang nire-request. I'm like, oh my god. Are you kidding me? So yeah, please tell your friends, tell your families, let the nurse do it. Don't ask for the doctor. If you want the best to put the IV line in you, it's the nurse, not the doctor. The doctor is the worst person you can ask to have your IV line inserted. I'm telling you right now. The worst you can ask for is to get a doctor do it for you. If the JI fails to insert, then it goes to the PGI. If that fails, it goes to the resident. By then, you already have a demerit. Yeah. That happens. That's fine. The training of the IV insertion for doctors starts at, like, junior internship. And then that's it. Sabihin mo, practice ko lang po, pasensya ko na pagmali. Yeah. There, that's. I think, when it comes to other minor procedures, the doctors can do it. Like, let's say, NGT insertion, nasogastric tubes. Nurses are trained for that, so most of the time they are able to get that one right. But there are times when the NGT kinks, so it is easier to insert an NGT for us doctors than an IV line, than an IV. And there's also Foley catheter insertion that the nurses can do, except when they are urology patients, like those who have enlarged prostates, because those ones are really hard to insert Foley catheters in, and they have a large prostate. So they are the hardest ever to put a Foley catheter in. Sometimes people see the doctor as a one-person medical team instead of seeing that there's an actual team. Yes! That's true! That's true. People look up to us way too much when we're not really. We're not really all that great. we're not that. We're not that great, man. We're not like a one-man team, man. We need other people. Okay, we need nurses. And nurses are the ones that see the patient all the time, and they're the ones that tell us that, you know, oh, there's a problem with this patient. Something is going on. Isang tusok lang. Now I know I should ask for Ivy. Yeah, just let the nurse do it. I mean, even if the nurses have a hard time inserting your IV line, it means it's really hard to insert an IV line on you. That's really what it is. It's not that the nurse is incompetent. It's that you're actually a hard person to. Your veins are not that easy to insert an IV line into. Okay, because if the nurse can't do it, if the nurse in the station where you are admitted at can't do it, they will find another nurse to do it. They will find they will find a colleague to do it. Like I know before there was a patient who had a really a very edematous patient, like swelling all over, needed an IV line insertion, and the nurse in the station can't do it. They start calling their other friends from the other stations, like, tawagin mo si ganyan, mas magaling magano, siya ay sharpshooter, like that. And then, you know, sometimes they even call the ICU nurse to go. They call the nurse from the ICU to go to their station just to insert the line. I've seen it happen. Doc, that happened to me during my second dengue when they can't tusok the IV. Yeah, I was poked twice. Yeah, if they can't insert it, it's because your vein is not easy, okay? Malikot ang vein nyo. Malikot, your vein moves, it happens. My worst nightmare was inserting in it. Yes, I hate inserting into patients. You know when the patient says, or the relative says like, gusto ko doctor mag-insert ng IV, and then I'm like, and then you see the patient has a freaking swollen arm, I'm like, hand and arm, I'll be like, oh my god, what is this? Sorry if it's off topic or if you already answered this before, but why did you choose to become a doctor? Keep it amazing whenever your streams. Thank you. Why did I choose to become a doctor? I think I was just brainwashed when I was a kid. I think I was just brainwashed by my mom. My mom always telling me when I was a kid, you're gonna be a doctor, you're gonna be a doctor. You'll be a doctor when you grow up. Doctor, and even my toys before would be like doctor toys. I think that's where it started, to be honest. But then after a while, after a while, just like, okay, I'll be a doctor. Because, ultimately, despite the brainwashing, it's kinda... It feels good to be able to help other people. It feels good to help other people. I believe naka-IV cut down. Yeah, I did IV cut downs. I hate doing that, to be honest. I hate doing cut downs. Biktima ng Asian parent expectations. Yeah, basically that. Asian parents will ask you two choices, lawyer or doctor. Yes. Become a lawyer or doctor. Okay. So, just doctor, lawyer. No. They wanted me to be a doctor. Okay. So, but yeah, eventually it was stressful taking medicine. But, I liked helping people. I mean, when I was in med school, it was stressful, okay? Med school is not easy. It's really hard, okay? I was taking, especially when I was in my junior internship, it was hard. It was tiring, but I think what pushed me to continue was that I had one patient. I'm just a junior intern that time, okay? junior intern only. I had one patient that thanked me one time. Thank you. Salamat po, doktora, na makakauwi na ako. Something like that. That patient told me something like that, and I was like, oh, and I felt like happy. I'm like, oh my god, I'm just a lowly junior intern, and I helped the patient, and I started thinking like, oh, what more if I'm actually a doctor, and then I see more patients and they thank me. So, and yeah, that's what happened when I actually became a senior intern. I would randomly get thanks from other patients. And then when I became a resident, it's the same thing. Yeah. Even until now. I like when I like when the patient actually gives you something. Especially I have a lot of patients that thank me by giving me like food. They give me like a basket of fruits or I had one patient that gave me salted egg, like a pack of salted eggs. Like, oh, okay, thank you. Yeah. What was the best gift you got from patients? Food. It's basically any kind of food. Like, I got donuts. Like, I got donuts. I got, like, lanzones. I got a basket of grapes one time. And then I got like, what else? Cake! Someone gave me cake. I also got mamon. I also got, yeah, mostly fruits. I got green mangoes. I remember getting green mangoes before. Yeah. And then one bought like Kenny Rogers. Gave me a Kenny Rogers meal. Meron nga Jollibee eh. Like, oh my god, Jollibee, yay! Think of that kind of thing. I mean, they don't need to give, they give food. And that's enough for me. I mean, just them being happy that they got better is enough for me already. Free food, yeah. Higher hurdle of a doctor if they got asked by a politician to run for council. No, I don't want to run. I don't want to be a run for anything. I just want to continue working. Anyway, yeah. It is 11:14. I think we're good. I think I talked about... What the heck? Wait, this is from Twitch. A Twitch follower. I got a new Twitch follower. Why is that there? That was supposed to be, like, silent. Because I'm in YouTube right now. Anyway, thank you for coming to my stream. Yeah, this was more like an informal kind of... It wasn't even a lecture, just telling you how it is in the hospital. My quiz, nah. This isn't an organ system thing, it's just telling you about the hierarchy and how it is for a doctor in a hospital, how stressful it is. So it wasn't really much of a lecture. We're just chatting, telling you about it. Pwede na mag-simulcast. Yeah, I've heard. So I'm actually thinking if I will do my medical education streams on both as a simulcast. But I'm still thinking about it. I might not simulcast like my usual streams, my gaming streams. But I will probably consider it for my medical education streams. Okay? So that people can watch on both platforms. And so that a VOD will be kept in YouTube. I mean, the reason why I did I started medical education streams on YouTube is so the VOD will be saved. Okay, so also, yeah, by the way, guys, I will be streaming tomorrow. I'll be streaming tomorrow. That will be my last stream before I go on hiatus. Tomorrow I don't know what to stream about tomorrow. Probably just be a chatting stream, okay? Oh, that reminds me. Tomorrow will be tomorrow is when that patient remember my Donathon on Twitch? His surgery's tomorrow, so I guess tomorrow will be the last time I stream, and I will talk about that patient, okay, tomorrow. It'll just be a chatting stream. And then I will go on hiatus. I will have a collab though on the 28th, but not on my stream. I won't stream it. It's a podcast with another VTuber, an international VTuber, so I'll just like share the link when that person posts about it. I'll be back like after a little after the first week of November. Probably around November 6 or whatever, I don't know. So, yeah. But I will still be active on my social media on like Twitter, Facebook, Discord. Okay. November 5, probably around that. Either, I don't know. I can't say, but it'll be around after the first week of November. November 7, or yeah. Something like that. November 6, 7, something like that. Magkakalat kami sa Discord para ma-entertain. Hoy! Wag kayo magkalat sa Discord ko! Anyway, yeah. Thank you. I will post a schedule tomorrow. Later. Or tomorrow. Okay. ShioriPon, everybody. Thank you for watching my stream. I hope you guys learned more about the environment of doctors in the hospital. Thank you so much, ShioriPon. I'll see you guys tomorrow. Bye-bye.